No fruit can flush plaque out of the arteries in your legs. But one fruit contains a natural building block your blood vessels use to relax, and that fruit is watermelon. I'm Catherine Blake, and I want to explain what watermelon may do, what it cannot do, and how to use it as part of a realistic circulation plan after 60. There is no medically proven number one fruit for leg blood flow. Watermelon is useful because it provides l-citrulline, an amino acid involved in the production of nitric oxide. Nitric oxide is a chemical signal that tells the muscular walls of healthy blood vessels to relax. Think of it as a message sent to a drawbridge. When the signal arrives, the bridge opens and traffic can pass more easily. However, if an artery is severely narrowed by plaque, sending a relaxation signal does not remove the blockage. Consider a man named Robert, age 69. He begins feeling tightness in his calves after walking 2 blocks. The discomfort disappears when he rests, so he assumes his muscles are simply getting older. He starts drinking fruit juice every morning, believing it will restore his circulation. 6 months later, he is walking shorter distances, and a small sore on one toe is healing slowly. Robert's mistake was not eating fruit. His mistake was using fruit to cover a warning sign that needed medical evaluation. Today, I'll explain 7 important parts of this topic. Why watermelon is different, how nitric oxide works, the best way to eat the fruit, why portions matter, how movement multiplies the benefit, which leg symptoms require attention, and what truly protects circulation over time. The first part is watermelon's l-citrulline. Many people assume watermelon is mainly sugar and water. It is mostly water, but it also contains l-citrulline. After you eat it, part of that citrulline is converted by the kidneys into another amino acid called L-arginine. The body can then use arginine to help produce nitric oxide. Imagine a delivery system with 3 stops. Watermelon delivers citrulline. The kidneys help convert it into arginine. The blood vessel lining uses that material to make nitric oxide. Each step supports the next, but the effect is gentle rather than immediate or dramatic. Small studies suggest that watermelon or l-citrulline may support certain measures of blood vessel function. A systematic review of randomized trials found improvement in flow-mediated dilation, which measures how well an artery expands. However, the review involved only 176 middle-aged and older participants. It did not prove that watermelon clears leg arteries, treats peripheral artery disease, or prevents amputation. A practical serving is about 1 cup of fresh watermelon. It can replace a cookie, pastry, or sugary dessert. Treat it as one useful piece of a heart-healthy eating pattern, not as medicine. The second part is understanding what nitric oxide can and cannot do. People sometimes describe nitric oxide as though it power washes the arteries. That is not how it works. Nitric oxide helps healthy blood vessels adjust their width, but it does not dissolve cholesterol deposits. The inner lining of an artery is called the endothelium. It works like the control surface inside a flexible pipe. When it is healthy, it releases signals that help manage blood flow, clotting, and vessel tension. Aging, smoking, high blood sugar, high blood pressure, and high cholesterol can damage this lining. Watermelon may provide material that supports the signaling system, but when plaque has made the pipe narrow and stiff, food alone cannot reopen it. This distinction becomes especially important when leg discomfort follows a predictable pattern during walking. Continue eating fruits and vegetables, but also know your blood pressure, cholesterol, and blood sugar. Those numbers reveal more about long-term artery risk than the effects of any single food. The third part is choosing whole watermelon instead of relying on juice. Many people believe watermelon juice is stronger because several servings fit into 1 glass. In reality, liquid calories are easy to consume quickly, and juice removes much of the chewing that helps you notice fullness. Picture whole fruit as a package that arrives with its own speed limit. You must bite, chew, and pause. Juice removes that speed limit, allowing a large amount of natural sugar to arrive rapidly. Fresh watermelon also helps with hydration, which supports normal blood volume. Mild dehydration can contribute to weakness, dizziness, and fatigue. Although drinking more water does not correct a blocked artery, choose fresh or frozen watermelon without added sugar. Eat it slowly and avoid syrups or sweetened watermelon drinks. There is no established medical dose that must be consumed every day. The next one is where many people get caught off guard. Portion size. Fruit is nutritious, but unlimited fruit is not automatically better. A very large bowl of watermelon can deliver much more carbohydrate than expected. This matters for people managing diabetes because high blood sugar gradually damages blood vessels, like rough water wearing away the inside of a pipe. Start with approximately 1 cup. If you have diabetes, consider pairing it with a small source of protein or healthy fat, such as plain yogurt or a few unsalted nuts. That combination may slow the meal and make it more satisfying. Do not stop prescribed diabetes medication because you begin eating more fruit. Monitor your glucose as your healthcare team recommends. People with kidney disease or a prescribed fluid or potassium limit should ask their clinician or dietitian how watermelon fits their plan. If you plan to replace a processed dessert with a serving of whole fruit this week, comment yes. That small change is more useful than adding watermelon on top of an already high-sugar diet. But this is where the circulation plan becomes more powerful. Food provides raw materials, while movement creates demand for blood flow. Some people eat a heart-healthy diet, but remain seated for most of the day. The leg muscles normally work like a second pump. Each time the calves contract, they help move blood back toward the heart. Regular movement also asks the arteries to deliver more oxygen to working tissue. Think of a delivery road that is rarely used. Watermelon may help maintain the traffic signals, but walking creates the actual traffic. The body adapts when the road is used repeatedly. Begin with short, comfortable walks if your clinician says walking is safe. You might walk for 5 minutes after a meal, rest, and repeat later. If calf discomfort appears during walking and reliably improves with rest, do not simply push through it without guidance. Ask about peripheral artery disease and whether a structured walking program is appropriate. The 2024 American Heart Association and American College of Cardiology guideline recommends structured exercise as an important treatment for people with chronic symptomatic peripheral artery disease. Exercise has much stronger clinical support for improving walking ability than any single fruit. The sixth part is recognizing what poor leg circulation may actually look like. People often assume that cold feet, cramps, numbness, and leg fatigue are normal after 60. Sometimes these symptoms come from arthritis, nerve problems, dehydration, medication, or an old injury, but a repeated pattern can point toward reduced arterial blood flow. Peripheral artery disease, or PAD, happens when plaque narrows the arteries carrying blood to the legs. It is like a delivery pipe becoming smaller on the inside. At rest, enough oxygen may get through. During walking, the muscles demand more, but the narrowed pipe cannot increase delivery. Common warning signs include aching, cramping, heaviness, or weakness in a calf, thigh, or buttock during activity that improves with rest. Other signs include one foot being colder, slow-growing toenails, loss of leg hair, changes in skin color, weak foot pulses, or a wound that heals slowly. The American Heart Association explains that PAD treatment may include exercise, heart-healthy eating, smoking cessation, and medicines to manage clotting risk, cholesterol, blood pressure, and diabetes. A clinician may compare blood pressure at the ankle and arm using a test called the ankle brachial index. Do not use watermelon to delay that examination. PAD affects more than the legs. It can signal plaque in arteries elsewhere, which is why it is associated with increased risk of heart attack and stroke. The seventh part is knowing when the problem has become urgent. Gradual symptoms deserve a medical appointment, but sudden changes can be an emergency. A leg or foot that abruptly becomes very painful, pale, cold, numb, or weak may have lost its blood supply. Think of a main valve suddenly closing rather than a pipe slowly narrowing. Call emergency services if this happens. Do not massage the leg, apply strong heat, or wait for fruit, supplements, or walking to restore circulation. Tissue can be damaged when oxygen delivery stops. A new foot wound, blackened skin, pain in the foot while resting, or pain that repeatedly wakes you at night also requires prompt medical care. These signs may indicate more advanced circulation trouble, particularly in someone with diabetes or a history of smoking. Supplements deserve similar caution. L-citrulline supplements may support nitric oxide production and some measurements of vascular function, but they are not proven replacements for PAD treatment. They may also lower blood pressure or interact with medicines. Consult a doctor before use, especially if you take blood pressure drugs, nitrates, erectile dysfunction medicine, or medication for heart disease. The final truth is that long-term circulation depends on the entire pattern. People search for one fruit because one change feels simple. Artery health, however, behaves more like a garden than a light switch. It needs several conditions working together: nutritious food, regular activity, controlled blood pressure, healthy cholesterol levels, stable blood sugar, adequate sleep, and freedom from tobacco. Watermelon can fit into that garden. So can berries, oranges, apples, pears, and other whole fruits. The American Heart Association recommends an eating pattern centered on fruits, vegetables, whole grains, legumes, nuts, fish, and minimally processed foods. Variety supplies different fibers and plant compounds that one fruit cannot provide alone. If you smoke, stopping is far more important for leg circulation than choosing between two fruits. If you have prescribed cholesterol, blood pressure, diabetes, or antiplatelet medicine, take it as directed. Food works alongside appropriate treatment, not in place of it. Now you know why watermelon is a reasonable fruit to include after 60. Its l-citrulline may support the pathway used to make nitric oxide. Its water content can help with hydration, and it can replace a less nutritious dessert. But it cannot wash away plaque or reopen a seriously narrowed artery. Your action step is simple. Add 1 cup of fresh watermelon to a balanced meal or snack. Then observe your legs during your next walk. Notice whether discomfort begins after a similar distance and disappears with rest. Check your feet for color changes or slow healing sores. Report concerning patterns instead of dismissing them as age. Subscribe for more calm, practical health guidance. Comment with the whole fruit you eat most often, and share this with someone who believes circulation can be repaired by one food.